people from Atlanta. This is an MS Views and News program. My name is Stuart. I'm president and founder of MS Views and News. This program is far different than anything we've ever done. And this is a trial program. We're hoping that people in the audience that are online, as well as those that are here, can appreciate what we're doing here. This program is more about NMOSD, which is a very rare disease, than it is for multiple sclerosis. And there are people that have been misdiagnosed over the years with MS that actually have NMOSD, but we're here today to learn the differences between NMOSD and multiple sclerosis. And for today's program, we're sponsored by Alexion Pharmaceuticals. Our first person, as stated, is a patient advocate. Her name is Jodi Arminio. She's a NMOSD patient, and NMOSD is neuromyelitis optica spectrum disorder, and she's a patient advocate. She runs a support group here in Atlanta, and so we want to hear from Jodi. So come on up, please, and let's get this started. Thank you.
My name is Jodi Arminio, and I am aquaporin 4 positive for neuromyelitis optica. My journey to a diagnosis and treatment has been documented on the Guthy-Jackson and SRNA websites and is familiar to my fellow support group members, some of whom are here. And so I will try to just hit the important points. In March of 2010, I was age 54, and I started having periodic episodes of weakness, shooting numbness in my left leg. I saw an orthopedic thinking I'd ruptured another disc. Had x-rays, lumbar MRI, nerve conduction tests, but nothing turned up. So I asked, after Googling my symptoms, could it possibly be MS? And he said I was outside the demographic, which was code for you're too old at this point. So his diagnosis was that possibly I had an entrapped nerve. Call me if it gets worse. It eventually eased and it did disappear. A year later, September 2011, I got a small dark spot in the periphery of my left eye. The optometrist exam said it wasn't a retinal issue and to see a neuro-ophthalmologist. I saw the only one with an appointment within 3 days. At that point, I was 2,500 and I couldn't see the big E. They didn't want to give me steroids until they knew there wasn't a tumor so I had to get an MRI, but approval was delayed due to snafus between her office and my insurance company. Finally, the MRI was done about 2 weeks later. There was no tumor, there was inflammation, and so 3 days of IV Solumedrol was prescribed, but I had no immediate improvement. 2 months later, November 2011, I developed a sunburn sensitivity around my torso, constipation, difficulty urinating, woke up one morning with numb feet. My oncologist brother-in-law pulled a favor and got me in that afternoon with his neurologist, Dr. Husami. Dr. Husami gave me a physical exam, took my blood sample, did an MRI that afternoon that did show spinal inflammation from T1 to T3. Put together with the optic neuritis attack, he guessed NMO and started me on 5 days of Solumedrol. A big difference from how my ON attack was handled. So there I was, legally blind in the left eye, numb to my chest, burning discomfort throughout my torso banding, walking by the grace of God, but holding on to the wall to help with my balance. I hadn't pooped in 4 days and I was having difficulty emptying my bladder. And I say to Dr. Husami, well, at least it's not MS. To which Dr. Husami handed me a journal article on NMO and cautioned me not to Google it. That night at 3 a.m., thanks to the steroids, I Googled it and read that the 5-year life expectancy for someone with MO, which is no longer true, and I did wish it was MS. But once diagnosed, I went on Imuran and then Cellcept as I kept having optic neuritis attacks on my right eye, but they resolved quickly with IVSM. Dr. Husami suggested I move to Rituxan since this was before the FDA-approved treatments that we now have. I had to battle insurance for approval and send them a 4-inch thick stack of studies and doctor letters before they would finally approve it for me. Meanwhile, Dr. Husami had transferred me to Dr. Ben Thrower at the Shepherd Center, hoping that the reputation of that facility would help me get approval. I've been with Dr. Thrower and on Rituxan ever since. We've had to adjust my dose over the years from 1 gram every 6 months to 1 gram every 4 months when I repopulated early, to now 500 milligrams every 4 months because of my low IgG numbers. But not being on a preventive med has never been considered. It would be Russian roulette for another attack. Rituxan, with the depletion of my B cells, has left me battling respiratory infections, especially after grandchildren visits, low IgG levels, and yes, I'm vain, excessive thinning of my hair. I manage the pain, the banding, spasms with gabapentin, baclofen, trileptal, and lidocaine, and the constipation, fatigue, and vision loss with various coping strategies. I have one good eye and I can walk, and I do not take that lightly. I will tolerate and at Shepherd Center even enjoy the 3 days a year I go in for Rituxan infusions to remain attack-free, although I take comfort that there are other treatments available should Rituxan sometime fail me. I've learned many lessons from my diagnostic experience. You have to speak up for yourself. Doctors are not gods. Google is your friend, and Google is also your enemy. When referred to another specialist or for a test, especially on a Friday afternoon, ask if there is urgency and act accordingly. Had I gone to the Emory ER when I couldn't see a neuro-ophthalmologist right away, I likely would have had my MRI and steroids the same day, and maybe a better outcome for my vision recovery. When you're told a specialist can't see you in 6 months, have your doctor call. They can get you in earlier. Don't get stonewalled by the appointment setter. Fight for your rights with insurance and with disability. It takes a lot of time and effort and research. Ironically, having fought our employee insurance to cover Rituxan, I had to fight again when I went on Medicare, applying for a local coverage determination of Rituxan for NMO and RCMA. But my win changed the coverage for all Medicare recipients, not just me. And take those lemons and make lemonade. Another patient and I started an NMO support group here in Atlanta 10 years ago, and it quickly expanded to include TM and other myelitis patients. We meet in person at the Shepherd Center on the second Saturday of each month. And thanks to my tech guru, Travis Edwards, we can beam you in virtually at the same time. If you want to join us, see me after the program. I'm going to be sitting right over there. I've met the most incredible, helpful, and inspiring patients through this group, and it is uplifting to be able to encourage someone else on this journey. Finally, I thank Stuart, and Erica, and Dr. Williams for the information we'll hear today on the similarities and differences between the diseases. I've been told I'm lucky to have NMO rather than fill in the blank. But whether it's MS, NMO, MOG, TM, or any other alphabet soup, no disease is better or worse than another. If it happens to you, it's devastating, physically, emotionally, financially, and it isn't a competition. So on this journey, accept that others with your diagnosis or another may be having a totally different experience than you. Learn from each other and have empathy, sympathy, and support for each other, regardless of our diagnosis. It's how we're all going to get through this. Thank you.
Thank you, Jodi. Thank you all for coming.